Hey YouTube, so this is the view from a chair. Welcome, thank you for joining and watching. Remember to go and subscribe, like, comment. I love comments and some corrective criticism and things I may not know, because I don't know everything. I don't claim to know everything, but these are things that help me out. And I'm going to show you guys, talk a little bit about common misconceptions about people in wheelchairs. Today is going to be about hygiene. Everybody has this preconceived idea that everybody in wheelchairs, they smell like poop, they smell like pee, they have drool coming down from their chin, they're unhygienic, and it's not true. So I'm going to be here to talk to you today about that, and then talk to you also about the things I use that really help me. I am very hygienic. I don't like to stink. I like to be clean. I don't just spray on cologne and shower once a month. I'm very hygienic in every sense. So a couple things to help me. One, we're going to talk about oral care. Okay, a lot of people that are elderly or disabled, whether you have the FA or whatever you have, a lot of times prescriptions, I'm on a lot of prescription drugs and they dry out your mouth. So I want to help you guys understand and spread a little knowledge about what can fix that. The first thing I have here, and sorry about, me just kind of going off camera. Very amateur. I'm learning. I'm trying to get better. But I do want to tell you that oral care is super important. Bacteria lives in your mouth, and sometimes it is not good bacteria. So it is important to brush and floss very well, especially if you're on a lot of prescription medicine. It dries out your mouth, and so all that stuff is just sitting in there, and it stinks, and it's awful. Not only does it stink, but a lot of people don't know this, poor oral hygiene can actually affect your health. It can cause organ problems, especially in the heart. It can cause rotting teeth. Sepsis, infection can set in and can make you go septic and cause a lot of issues. So, a dry mouth can really heighten that. Because a dry mouth, your gums will start having issues. You'll start with the teeth rot, things like that. So a couple things help me out. One, I do brush twice a day, and also I floss after every meal. Flossing is super important. I'll show you. I use these little things because I have hand coordination problems. And so it's hard for me to use regular floss and get back there. But so I use these little things. They're disposable. You can get the ones that attach to a long handle, whatever you prefer. But I like these that have really tight contact, meaning my teeth don't have a lot of room in between them. So I just take it and I start at the back and work my way around. That is very important, is to always floss it all the way back, not just right here, the front, whatever. Floss in between all of them, and you don't have to be painfully aggressive, but be aggressive with it. Go in between each tooth on the side, scrape. Go back and forth like this. It will take a lot of those bad things out. Food stuck in between your teeth, things like that make you stink. So, very important. The other thing I use, now FA patients, me especially, have temperature sensitivities. And so a lot of people like Sensodyne, but it doesn't work for me. So I have to be careful what I eat and the temperature of things I can't. I eat things that are really cold. I can eat things that are really hot. I use, so for my toothpaste, I use Periodontax. I use the Whitening Complete Protection. It is a little more expensive, but it's well worth it. I love it. It's good for your gums. It's good for dry mouth. I'm not saying it'll cure it, or that's specifically what it's for, but I'll get to that in a second. But it's good for daily fluoride, anti-cavity, and anti-gingivitis toothpaste. And, it's very important because we can develop, all these medications really bad halitosis due to gingivitis. So it's very important. And also, I follow with a Listerine mouthwash. I'll explain that in a second. I use tongue scrapers. I have a really bad problem because of all the medications, and I am a smoker. I have a real problem with buildup on my tongue. So I use tongue scraper. You can get them like at Walmart or, I don't know, Kroger, wherever you shop, CVS, Walgreens. They look like this. But it's very important to keep them clean. You don't use it and then throw it in the drawer. That's gross. You want to keep your stuff clean. That's another step when it comes to oral hygiene. Your toothbrushes, you want to keep them clean. You want to change them out, your toothbrush heads, whether you use a manual or an electric toothbrush. You don't want to use the same head for like 3 years. You want to change them out. I think mine is every 2 to 3 months. So I change mine out. I keep mine clean. I keep all my oral tools clean. And very important. You don't want to be trying to clean out bacteria by using something that's got all the bacteria on it from the previous use. It's gross. But the Listerine. You want to, for us, having all these medications and the dry mouth and stuff, alcohol that they put in the Listerine that causes, the burn, it is good. It really cleans, but it makes your dry mouth 10 times worse. So you want to get Listerine with 0 alcohol. Again, talk to your dentist about the best things to use. But my dentist said anything with no alcohol in it. So whatever you use, whatever type you use of mouthwash, be sure 0 alcohol. The next step that I found that really works for me is Biotine. Love Biotine. It's a little expensive, but it's well worth it. Smart Mouth, I think it's called Smart Mouth. It's an oral care mouthwash, 0 alcohol. Xylitol, I think it is. That prevents the dry mouth and really helps. So look into those. They make lozenges as well that you can pop in your mouth, throughout the day to help you as well. Very important to try and fight that dry mouth as much as possible. I really struggle with it, but I do my best to keep my mouth clean and to combat that dry mouth. So, the second thing I wanted to talk to you about is people in wheelchairs. Just because you're not working out, just because you're not sweating, it's very important to always wear deodorant. I can't believe I'm even saying that. Like, that has to even be said. But a lot of people are like, well, I don't sweat. I'm in a chair, no biggie, so I don't have to wear deodorant. Well, you do. Because, well, we won't go into that. But what I use now, I used to use I'm not going to say the name of it, but I'm going to say that, I would use it and it was really good. And, like, it would last it lasted. I mean, it was great. But I didn't realize how unhealthy that was. They put aluminum and they put all these chemicals in it to make it last and to make you smell good. Well, I found something different. All natural deodorants. Dr. Swatch. Love them. I love their all natural soaps. I use them. That'll come in a later video, but Dr. Swatch is very good. They have different ones, different scents, but I love it. It is all natural. It's aluminum free. A lot of them now you can buy on the shelf that are all natural, whatever you prefer. But what happens is a lot of people, they stop using it after a day or two because they're like, it doesn't last. I stink. Well, it takes your body some adjustment. It takes some time. So give it about a week. After about a week, I was fine. The deodorant was lasting. The only thing is you have to go and put you on a couple of swipes every morning. Just to kind of give you a refresher. Really like Dr. Swatch. Invest in it. It's good for you. It's not going to damage you. All those chemicals are not soaking into your pores. Let's see here on my list. Okay, we're going to come to the not so comfortable situation. Let's see, and I forgot one you're going to see. It's really hard to maintain a healthy weight in a wheelchair, and I will do a video on that later. But you're going to see I'm a little chunky. Bear with me, I'll get it out here. Okay. So, genital care, very important. Some people they use calves, disposable calf, in their genital area. And I want to kind of go into that. So if you don't want to listen to this, it's fine. But it's very important. You need to keep yourself clean down there. Very important. Bacteria, sitting in a chair all the time, bacteria can build up. It's not very, the smell, not only the smell, but it's bad for you because your areas down there that you are sitting on all the time need to be cleaned, like with an antibacterial. So I found a couple things to help me. I'm not a catheter. I don't use catheters yet. I'm trying my hardest to stay away from them for as long as possible. But with calf, it is very, very important to keep everything clean because they can develop bacteria. They can cause an infection, and that infection can cause sepsis, and it can cause major issues, and it can kill you. So you definitely want to keep that area clean. So we're going to talk about genital care here. First thing that I do is I have 2 bars of soap in the shower. I have an antibacterial bar, which is just like Dial or something like that. Just cheap bar of soap that I use in my genital area and in the rear, just to give it a good clean. And then I use my all natural soap, bar of soap, and I will show you guys about that in a later video. But what I use in my personal areas is, I have one, it's called Aloe Vera, I think. It's really good. They use it in nursing homes a lot. But this is one that I have. This is for sensitive skin. It creates a protective barrier. It moisturizes. It prevents any kind of rashes or bed sores or things like that. Because it's very important to keep that area clean and dry, because sitting on it and laying on it all the time can cause bed sores and cause issues down there. So you definitely want to use something like this. It's a skin protectant, CHG compatible, adheres to and helps treat denuded skin, easy to apply and remove. It's fragrance and dye free, and it's for all ages. So you can get it in sensitive, if you have sensitive skin. But I don't have super sensitive skin down there. So after my shower, I rub some in my areas to help those, because you don't want to put anything down there like talc, whatever you want to call it. You don't want to put anything down there that's not meant for your genital areas or your personal areas. Very important. The other thing I use is these. Hold on, I'm working on it. These. They're wonderful. They're by Madeline. They are Ready Bath Luxe. Luxe. They're wonderful. They're antibacterial bathing cloths. So in between showers or when you're not feeling so fresh, you can use one of these. They're wonderful. They're made for all areas of your body. Well, external areas. Don't put one in your mouth or in your eyes or anything. Your underarms, your chest, your belly, your personal areas, anything like that. But they're wonderful. These are scented. You don't have to get scented ones, but I think like a big box of them cost me like $30. I mean, they're not expensive at all. And you can get all this stuff on Amazon, which is great. Have it shipped right to the door. Nobody ever has to know what you're buying. You don't have to go to the store, and it can be a little embarrassing, So you can have it all shipped to the door. But if you are a female, this is my experience as a male. But if you're a female, you need to talk to your gynecologist. You need to talk to your physician, because there are things that men can use in their genital areas that women cannot. And that is not good for women, such as baby powder. Putting baby powder down on the vaginal area is not good. You can use baby powder, but I have found the towel-free, but I found that it dries me out a little bit too much. So I don't really use baby powder much anymore. Still have it, but not much. So if you are a female, you need to speak to your doctors and ask them what they recommend you using. I think Vagisil and what is the other one? The other one makes personal wipes and pH balancing wipes and antibacterial for that area. Okay, so now, excuse me. So now we're gonna do a little segment here about bum care. Your butt. Your butt, very important. A lot of people don't realize, like, your comfort in a chair is very important, and your skin down there your skin is the first level of protection against any kind of bacteria or harmful germ entering your body. So it's very important to keep that area down there clean. So again, I use in between showers, so whenever I'm not feeling fresh, I use the Medline antibacterial wipes. But specifically for your bum, every time after you go to the restaurant, number 2, you need to get you something like this. They are flushable wipes. A Cottonelle makes them, you can get all kinds. Dude wipes, they're safe for all genders, and they're safe for use on just about everybody. They're just flushable wipes that you can, freshen yourself up between the cheeks. They're very good. I highly suggest. And it will save you a bunch of money on toilet paper, because you can cut back on your toilet paper use and use one of these. I get the extra large ones, so you can get the regular sized ones, but I get the extra large, so it's more of a wipe. So very good. I highly recommend. Something that I'm gonna wrap bum care up. Something that we, as wheelchair users, me, I'm not paralyzed, so I can still feel everything. We strain to do everything. You don't realize how much you strain at all. Like, you just don't get it. But see, I lost my train of thought there. But we develop hemorrhoids. I hate them. I hate talking about them. I hate telling people that I struggle with them. It is just not something I really want to discuss. But I want to help you guys. So here we go. Struggle with hemorrhoids. It's just all part of the game. Sitting all the time. They're very painful. But there are some things you can do to combat that. Well, one, obviously, you can go to your primary care physician and they can prescribe you prescription grade hemorrhoid cream, great, or suppositories or anything like that. But what I use, because I'm not quite at that point yet, what I use is it's RectiCare is what it's called here. I'll get it closer to the screen here for you. It's over the counter. It's not prescription, but it's good. It works really well on the itching, the burning, and the pain of hemorrhoids. I also use, Totables by Preparation H with the lidocaine in them. If I have a real bad, I call it a flare-up. If I have a really bad issue, they're also really good. Is a pack of Tucks, or the little drum here. They're cheap too. I mean, like, these are medicated cooling pads. They're hemorrhoidal pads with witch hazel in them. They're cheap. It's 100 pads. 100 pads could last you 6 months, depending on your what your doctor tells you to do. But these are really great. I love them. Tux, you need to invest. Great. But yeah, so just to recap about all that. Very, very important to keep everything down there clean. Up here clean, your face clean, your mouth clean. Anything that you guys use that really helps you, let me know. Let me know in the comments. We're all here to help each other, so let me know. The last thing I'm going to talk about when it comes to hygiene is foot care. Foot care is very important for wheelchair users. I don't have a lot of problems as of yet with my feet, but I do right now have an ingrown toenail, which is common with people like me. And it got infected, and my doctor, I'm on antibiotic, so it's getting taken care of. But it's very important to cut your toenails correctly, and not too short, not too long. You don't want to cut close to the skin. You need to follow up with podiatrist if you're having a lot of issues. But my grandmother always used to tell me, your fingernails are to be cut like a half moon. Your toenails are to be cut straight across. You're not to curve them. But you can go on Google and read about proper toenail care. But it's very important to keep your feet clean. You can use your regular soaps, or take an antibacterial bar in the shower. Just run, or have your caretaker or whomever come in there and wash your feet for you with an antibacterial. Also, Epsom salt soak is very good. It's very stimulating. It soothes aching muscles, and also it softens the skin down there, and it really helps. So I would encourage each of you to do that. The last thing about foot care that I have to input is keeping them moisturized. I have Gold Bond foot lotion. It's made specifically for my feet. Do not use it during the day. I would not suggest that because it can get a little slippery. So what happens is we put it on before I go to bed. That way it has time to soak into the skin. I'm not endangering myself, slipping lotion on your feet. Not a good idea. But that's really it. I just wanted to share with you guys a couple of things. Maybe put a stop to this preconceived idea of people like me. And just, shed a little light on what we have to do and what we have to go through to take more extensive steps to be more hygienic. And that's what we have to do. But I'm telling you, it will change your life for the better. It'll make you feel better if you follow some of the things that I do. And again, I'm not a physician. If you are having issues, I'm not a dentist. So if you are having issues, I would encourage you guys to speak to your doctors, to your dentist, things like that, because I don't want to give anybody misinformation, and I definitely don't want to harm anybody. So if you have some concerns, maybe you have open wounds, maybe you have bed sores, you need to talk to a wound care specialist, and your primary care physician can refer you over to wound care, and they can help you get that taken care of. But I really hope that this helped you guys. It was informational. It was knowledge, spread a little knowledge about FA. Go back and watch my videos on here. Like I said, they are kind of, amateur. They're not very professional, but still, I hope I'm getting the point across. Also, feel free to comment. I love corrective criticism. I love to hear back from people. Absolutely. But do it respectfully. You don't have to be ugly. You can bring up your points and maybe your concerns in a respectful format. Also, I'm still raising money for my handicap equipment, my medical cost. So I will put the link tree down in the description below. You can follow that. It is to my Instagram, not my PayPal, I'm sorry, Instagram, Cash App, Venmo, GoFundMe, and my Amazon wish list. If you guys have any questions, concerns, or anything, leave them in the comments below. And thank you so much for the view and watching me. Like, comment, and subscribe to this channel for more information that'll maybe help you, or maybe you're a caretaker, and I can give you a few points on how to help the person you're caring for. Thank you so much for everything, and you guys have a good day. And just remember, in everything you do and you say, show love and kindness. Thank you guys so much.